Fear is rising in West Africa amid the region's first ever Ebola outbreak. The outbreak began in Guinea's southeastern forest region in February and has been spreading ever since, with the death toll continuing to go up. Linord Moudou covers African health issues for VOA and joins right now. Thank you so much for joining us.
My pleasure.
What is this Ebola? Can you please explain?
Well, Ebola disease is, the Ebola is a virus that was discovered in 1976 in the Central African region, precisely in the Democratic Republic of Congo. Back then it was Zaire. And it's one of the most virulent diseases known as of today. And it can cause death within days, and it's very, very dangerous.
And what are the West African health officials doing to try to contain the outbreak? Is there a cure? Can you avoid getting it?
You can avoid getting it. Some of the steps that have been recommended by health officials include keeping basic rule of hygiene, such as washing your hands, avoiding bushmeat. Some of the countries in the region, it's part of the diet to eat bushmeat, such as maybe monkeys or bats. So officials are really encouraging people to avoid eating meat as of now. And if you feel any type of symptoms, which include fever, vomiting, diarrhea, to report to the nearest health center. If there is a cure, no, there is no cure. There is not really a vaccine either. What they are doing to address the issue with people that are sick is to treat the symptoms, to keep them hydrated, and ensure that their own body kind of reject the virus.
But how does it spread?
It spreads, first of all, from the animal to human. It spreads by touching, coming in contact with an infected animal, wild animal. And from human to human, it's if you touch someone through bodily fluids, let's put it this way, the blood, semen, or any other type of bodily fluids, that's how it is spread.
But how, correct me if I'm wrong, I mean, eating bush meat is a part of many people's culture. I mean, how can they avoid eating meat which is a part of their diet?
It's very difficult, of course. I guess the most critical time is when there is an outbreak, obviously. So you just have to make the sacrifice, so to speak.
And lastly, it's been coming in outbreaks, cropping up and coming and going. Why do you think that has been happening?
It's difficult to say. Even the experts will tell you, because Ebola is unpredictable, it's rare, and it happens often in remote areas. What is happening today with the case in Guinea is rare, because we see it happening in Conakry, in the capital. So it's very, very difficult to tell. What health officials hope is that they are able to contain it. Right now, WHO is working closely with the Ministry of Health in Guinea, as well as Médecins Sans Frontières, Doctors Without Borders, and they're really keeping a close watch on the people that have been around those who are sick, and the people that, even health workers, because they are very much victimized in a crisis like this.
Linord Moudou, VOA Africa Health Reporter, thank you so much for joining us.
Thank you.
Thank you.